Hi, my name is Nat Jason, and I attend the University of Arizona as a second-year biochemistry major. This summer, I worked in Dr. Pohl's lab. The lab mainly focuses on the design and synthesis of new glycopeptide drugs for the brain. The main research question the lab is trying to answer is, how can we convert endogenous peptide hormones into drugs in a straightforward manner? In other words, how can we create drugs for the brain from the brain? The relevance of the question is shown by the medications we have currently available in the pharmacy. New drugs in development for use in the central nervous system have the highest failure rate, primarily due to their inability to cross the blood-brain barrier. The blood-brain barrier is a strong barrier that prevents otherwise effective pharmaceuticals from reaching the brain. One peptide hormone the lab is studying is oxytocin. Oxytocin is one of the oldest hormones found in all mammals. It controls in-group and out-group behavior. It is involved in many different physiological processes in the body outside of the brain. So by creating oxytocin analogs, we're hoping to create painkillers without the usual opioid side effects. These new drugs may be useful for the treatment of opioid use disorder, social anxiety disorder, Asperger's syndrome, and Alzheimer's. My main part this summer was creating standard operating procedures for equipment and procedures done in the Pohl lab. It aligns our scientific exploration with clinical exploitation. In other words, we can ensure that the procedures conducted in the Pohl lab correlate with the procedures that are done in the industry on a larger scale. SOPs are clearly written steps that you could give to a robot and it could repeat them without any issue at all. They also ensure that all the machines are used properly and all the procedures are conducted in a consistent manner. The eventual goal of this work is to gain Good Manufacturing Practice Certification, or the GMP, making way for the glycopeptide hormones being created in the lab to be studied in humans during clinical development. Some of the questions I have left are, how can the SOPs be maintained and used in the most effective way possible? Will the oxytocin compound work? And what are the potential side effects that may occur? Will the oxytocin compound be bioavailable? Thank you.